Once fecal incontinence is diagnosed, the treatment can really be can vary from non-surgical or non-invasive modalities to surgical invasive modalities. An example of non-invasive or surgical modalities include dietary changes, modification of and the medications that the patients may be taking, or adding a constipating agent like Lomotil to decrease the diarrhea and help bulk the stool up. Some other modalities include physical therapy to the pelvis, which is another word for it is biofeedback therapy, which helps strengthen the anal muscles and rectal muscles and decrease the symptoms associated with this condition. Patients with fecal incontinence that have had a traumatic injury to their sphincter muscles, which caused a disruption in their sphincter muscles, may benefit from surgery, which is called overlapping sphincteroplasty, where we correct that defect and bring the muscles together and overlap them to help them control their stool or gas better. Patients with intact sphincter muscles may have a nerve damage that cause them to be incontinent. These patients benefit from a nerve stimulation, such as sacral nerve stimulation, which is a pacemaker implanted the same way some people get a pacemaker for their heart. There's a pacemaker now for the anus and rectum to help them control their bowels. Surgery for fecal incontinence are mostly outpatient procedures. A patient leave the same day after their surgery is done. The recovery usually is also quick. It may be up to a week after the surgery. Results may take a little bit longer depending on the extent of the surgery that was done. For overlapping sphincteroplasty, the healing and scarring takes months before the end result is seen.